Hello and welcome to Invisible, Breaking Through the Stigma of Addiction. This is a local television show that we have that talks about addiction and how it impacts the City of London and the people in it. I'm Dean Anderson, your host, and today we have somebody who has really experienced the front line in the City of London. Her name is Karen Burton, and she's from the London Inner Community Health Centre. Welcome, Karen.
Thank you very much. Thank you for having me.
My pleasure. Karen, what is it exactly that you do? Can you describe your role?
Absolutely. I am a harm reduction worker, an outreach worker, and I work with people who use substances in the City of London.
So in that process, a big part of it would be constituted the harm reduction, we call it, right?
Yes.
Can you explain to me what harm reduction is from your own words?
Sure. So harm reduction is a set of practices, policies, principles that have been put in place to help people use their substances safer. So it might be that somebody who's on the weekend and they're using cocaine with their friends, and their dollar bill that they use, we might say to them, could you use a straw instead of using the dollar bill? The bill has all kinds of dirt and germs on it. Right. We don't want you putting that up your nose. Your mucous membranes are really delicate. So if you have a straw, we also want you to use your own straw. We don't want you to share your straw with somebody else. So we're also not asking you to stop the practices, the substance use that you're doing. So harm reduction is very much, we want to make what you're doing as safe as possible for you without saying to you, you have to stop doing this, but also bear it in mind, should you want to stop doing it, we're there to help you with that as well. So harm reduction can go from all the way from people using casually to methadone to abstinence. There's a whole group of things in harm reduction, and I think a lot of people don't realise that it can reach from casual use to complete abstinence. I think a lot of people think that harm reduction is, I'm showing you how to use safer, but I'm not actually offering anything else in that. So yeah, that in kind of a nutshell is what harm reduction is, yes.
And your description just nudged about 1,000 questions in me. What I've heard in the past and what people tend to recognize is it's immediately going to needle exchange and those sort of things are harm reduction, but you gave it this big broad spectrum of what harm reduction is, and then saying that we're not telling people that they have to change if they don't want to change, they can continue to use their use. What's the mentality behind that?
I think it's realizing that if you want to connect with people, then you need to meet them where they are. And what is wrong with saying to somebody, hey, there's a different way to do this that might be a little bit safer for you, but I don't need anything else from you. I'm going to introduce this to you. Should you choose to use it, great. If I can get somebody one time out of 10 to do something a safer way, I've still won, right? I've got them one time out of 10. So the plan is that you want people to practice safer all of the time, but realizing that when I change a habit of my own, am I going to do it all the time? Sometimes. It takes time to get there as well. So some people straight off the bat, that habit will be that practice that they use to use safer will be all of the time that they do it now. And some people, it will be here and there that they use that practice, but you've still got them more than you had them before.
So so it's about safety, it's about well-being, it's about learning and growing and developing and being as, and I'm assuming that, when we talk about other types of harm reduction like safe supply and supervised consumption, we're all actually saving some lives too.
Oh, definitely. And the other thing is people have this, not all people, some people have this fear of a safe consumption site, but a bar is a safe consumption site where you actually get your substance. You go to the bar and you buy your substance. So, and again, people will say, well, it's legal, but it wasn't always legal. So it's a safe consumption site is somewhere that somebody can go and take their substances with them. Are those substances illegal? Sometimes. Sometimes they are. Sometimes they're their prescribed medication that they're using at that site. When they walk into that site, they are asked, what are you using? What substance are you using today? So people know what substance they're using when they walk in. They're given new equipment when they walk in the door to be able to use safely. There is somebody there to offer advice should they want some advice on how to use safer. And there's somebody there if they overdose. And it's not just overdosing. Sometimes people can over-amp on crystal meth and stimulants. So you're there as well if somebody overamps, and you're there to help them so that they're not just leaving and, you know, their heart's going a million miles an hour, their blood pressure's through the roof, they're at risk of stroke. You've got nurses in that room and paramedics who can help people out if somebody overdoses. They are there to bring them back, to be able to administer naloxone if needed, to administer oxygen, to keep an eye on somebody for hours afterwards. I think the other piece that sometimes gets lost is that you've got that room where people use their substances and they inject their substances in that room, and then there's a little room just beside it, and that's where people sit afterwards to rest. That is your chance, as well as in the room when they're using, but more importantly, over in this other little room is your chance to build a relationship with somebody. Using substances, when somebody is injecting their substances, in my opinion, is one of the most intimate things I have ever been part of. So being in that room when somebody is using their substances, that's a really intimate thing for that person. And for them to be okay with sharing that with you, I think we don't realise how the trust that is involved in that. Once you have that trust, then you build your relationship with a person, and it's a different kind of relationship than somebody just popping in to pick up something. You get to know more about them, about their family, about what brought them to your services in the first place. It also gives you an opportunity to be able to plan with them what things down the road might look like for them. If they are looking to make changes, what do those changes look like to them? Because if you and I are working together, I can have all the ideas in the world, but if you don't want to go along with them, or if they don't fit your agenda, me coming along with my agenda, it's not worth it. The other thing I think is rehab. When people go to a 30-day rehab, we have this thing where 21 days to change a habit. I think that's things like biting your nails. I do. That's what I think. I think it's stuff like that. Maybe it is bigger stuff, and maybe it has worked for other people. But for me, 21 days to change a habit doesn't work. And also, a habit is not necessarily a healthcare issue. So somebody who uses substances goes away for 30 days to a rehab, and that's great. Their body's had a break, and we hope that when they come out that they continue to stay sober. And if they don't, we tend to consider that they're a failure. What I want people to realise is that somebody has a break from using substances, be it a day, be it they've put off using for an hour, be it the 30 days or however long, I think it's important to realise that their body had a break for that time. It had time to start recovering, and they learned so much when they were in there. So if they come out and they start using again, their tolerance is low because you haven't used for a while. I mean, you can go away for a weekend, not use, and come back and your tolerance is really low. So 30 days, your tolerance is completely gone. So you want somebody to go into a safe site to use, so that if they do overdose because they think that they can use what they used before, if they do overdose, somebody is there to help them. Ideally, if somebody goes to rehab, they're going to come out and they're not going to use again. The reality is it's peaks and valleys. And for some people, it takes many, many stints in rehab before things change for them. So I think building relationships with people where when they are using, they're looked on as the person that they are. We don't define people. I have depression. I'm not depression. I don't walk around saying, I'm depressed. Hi, I'm Karen, I'm depression. I say I'm Karen, and if it comes up, like it has with you, I suffer with depression. It isn't who I am. We, as a society, someone's an addict. No, they have an addiction that may or may not be with them for the rest of their lives. So it's important to build that connection with somebody and be able to help them. And also the other thing people don't realise is we really learn from our clients. We learn so much from our clients. Being able to, talk to somebody about the way they use their substances and why they use them that way. A lot of times people will say, well, that's what I was taught. Somebody taught me to do that, who I was using with that time. And so it'll be like, okay, so why don't we try this way? And these are the reasons why. It will be for safety. But I also don't ever want anyone to feel that they're stupid, I don't ever want to say to somebody, oh no, what you're doing is wrong. Your practice is wrong. I don't ever want to say that to somebody. I will say, why don't we try this way? We have learned that if you do it this way, if you face a needle upwards when you're putting it in your arm, it's kinder to your vein. If you use alcohol before you inject, you're getting rid of germs. If you use alcohol after you inject, it might bleed a little bit, so let's use a little dry pad. So things like that that people may have learned from other people. It's about teaching, but doing it in a kind way. I think kindness is massive. I think we all judge a situation when we walk in a room. But I think being with somebody and making sure that your judgments are based on kindness and are based on not getting, my way is right, where everything I say is right. Even if I have all the evidence behind me, if you don't want to do it, do I want to lose that relationship with you? No, I don't. I don't.
No.
Yeah.
So I so much information there, which is bringing us into the end of our interview. But I hope everybody listens to that and listens to that wonderful information, because it was very articulate and well put. I couldn't put it any better. There is something to be noted within the stigma and shame of things that we isolate and separate people in that process, and we believe that separating them and isolating them is what's going to help them. This tough love, if you don't get what you want, you're going to have enough pain to want to change. But the reality of it is the pain requires more medication, and then they have to use more. So what you're saying is give them some love, show them some openness, show them that there's a way, show them there's help, show them that someone cares, and then when they're ready to change, they can change on their own steam.
Absolutely.
Wonderful. Thank you, Karen. I appreciate you being here on the show and sharing all that great information.
Very
and I look forward to talking to you more in the future.
Excellent. Thank you so much for having me.
My pleasure. We'll be right back after this break. Welcome back to the show. We couldn't talk about harm reduction without having our next guest on. Dr. Ken Lee is an addiction medicine doctor, and we had him on the show last season, and we got to talk about some of the harm reduction methods he was using. And there's been since more advancements, more information, helping more people. And so we're just going to jump right into talking to Dr. Lee. Thanks for being here.
Thanks, Dean. Thanks for the invitation. We're very excited at the RAM Clinic here in London. During this COVID pandemic, we've had the opportunity to trial a new treatment, a new medication for opiate addiction. And as you know, fentanyl has been a great problem in our city. But we think we are getting some answers now. So what we have been pioneering here in London is the use of monthly sublocade injections. And the beauty of that is that it provides month-long steady levels of buprenorphine, which is the main component in Suboxone. And in opiate addiction, all we had before was methadone and Suboxone. We now have other options, including safe supply, pandemic safe supply, some people call it in Vancouver. We call it Safe Supply here in London, Ontario. But now with this other option, we've treated 250 patients since October 2019 with Sublocade. And we have had no overdose deaths in this patient population. A lot of tweaking, a lot of adjustments in our protocols. But we're very excited by this. I just presented this data to a number of international conferences in Minneapolis, in London, UK. Just this morning and Friday, I'm headed to Italy to share our experience.
So I'm just going to be jealous about you going to Italy for a minute and and being able to travel and spread this wonderful information. So the Sublocade is an injection that works in the same way that methadone so it's an opioid replacement therapy, right?
Right. It's an opioid replacement therapy, but the beauty with Sublocade and Suboxone is that it treats the withdrawals and the cravings that people have after using fentanyl. But at the same time, it blocks out the euphoric effect of fentanyl. And so what patients have told me is, hey doc, if I can't get high, that means I can't die. And we suspected this when we learned about the availability of this treatment. But now we've collected data for 250 patients now and have papers published, poster presentations at various international conferences, and a paper is in the works right now. So we think we have an advance that we can share with the world. We've been doing this for 2 years now in London, Ontario, and it's time to spread the word. The new thing that we've learned is that we can start this treatment very quickly. So at the RAM Clinic, just this week, we had 10 new patients roll in asking for, quote, the needle. And these are people who show up in clinic in various states of withdrawal. And if they're in withdrawal, we're able to macrodose a start on Suboxone and then give them the Sublocade injection within 2 hours. Wow. And so from the time you come in the door to the time you walk out with your withdrawals controlled and cravings controlled is 2 hours. Wow. And after that, if you do choose and relapse to fentanyl use, the effect of the fentanyl is blocked. And this is how it provides overdose protection.
Wow. So the old way of doing it was someone would have to go into withdrawal, and then they would have to go and microdose onto some other opioid antagonist, and then they would slowly increase that dosage and get to a point where now you're saying that they can come right from withdrawal right into a Sublocade, right into a...
Yeah, that's right, Dean. It's an amazing advance. It was pioneered in California through the California Bridge group of clinics in Los Angeles, San Diego, et cetera. It's a large group of clinics. They pioneered this in the emergency department. We've worked together with doctors in Timmins who have pioneered this as well. And we brought this protocol to London. So yes, we've been doing this for about 3 months now.
He's so humble when he says we, but I know that you're incremental in this whole process and bringing this to the city. And it's there's a big name here. And for those that don't know, RAM stands for Rapid Access Addiction Medicine, and it's a clinic down here on Queen Street. Am I correct?
Yeah, it's down at 200 Queens Ave.
Okay.
Queen and Clarence.
Awesome. I wanted to make sure we got that plug in there so that people know where to go, right? You're
Yeah,
going to say
thanks,
something
Ian.
else? Sorry, I jumped in.
Yeah, I was thinking, we called ourselves the RAM Clinic, Rapid Access Addiction Medicine Clinic, right? So I guess we're now ultra rapid.
new and improved. Yeah, in this culture, we always need that shiny penny, right? So I can't overlook the way you started the conversation to say 0 overdose deaths. I mean, that's massive. We recognize that we've seen more overdose deaths than COVID deaths in relation to how big this thing has become, especially with the crisis.
Yeah, that's right.
Right. What are the biggest takeaways from this, and how are you sharing this information with Germany and Italy and all these other people?
Yeah, the greatest takeaway is that now, with regards to opiate replacement therapy, methadone, Suboxone, Safe Supply, is that you have an exit strategy now. You don't have to be taking a medication every single day. You don't have to be going to the pharmacy every day. You don't have to have all these frequent doctor visits, right? You come to the RAM Clinic, get an injection once a month, then you're off and on your way.
Right.
It's an amazing advance for people.
Right. I don't think most people recognize or realize that every tiny little barrier, every little gap in service, or every time I've got to go and do something, that's a window for my drug use or my addiction to slip into that gap, right?
Right.
And you're removing the gap.
Right. It's a major impediment to treatment retention. All the requirements for doctor visits, pharmacy visits, urine drug testing, samples, and all that, we've taken that all away.
Right.
Most people can usually make time to go see the doctor once a month.
Right. And the thing that really stands out in my mind is there's a behavioral change with having a one-time shot, right? I mean, by getting the shot and then not having, you said earlier, not having to take that, the medicine every day or having to go there, right? I think people don't recognize that if I was trying to stop eating cookies, but I walked to the pantry every 20 minutes to look in the pantry, I would be reminding myself that I want to eat cookies. Whereas, having this suggestion, I'm not going to the pantry or going to get that daily dosage or doing that thing that doesn't remind me that I have to medicate from my addiction.
Yeah, that's very well described, Dean. And pharmacologically, it works well as well because there's no peaks and valleys in the plasma levels of the medication, right? So when you're dosing methadone, Suboxone daily, it goes up and then goes down and goes up and then goes down. And people describe in the morning they feel kind of lousy and crummy and beyond the usual, I need my coffee, right?
Yeah.
People on Sublocade don't describe that. They described a very smooth month.
Yeah. So those ups and downs, and we on the show we talk a lot about the emotional impacts as well. So those ups and downs can cause emotional dysregulation, and that emotional dysregulation means I got to take care of this. I got to do something to take care of it. So that even keel helps with the emotional regulation as well.
Exactly. The constant daily reminder that I'm addicted to fentanyl is gone. You don't have to think about it.
Right.
People describe this as feeling normal. And the very interesting thing is that people will tell me, what am I going to do with my day now? I have all this time.
Yeah, because even in the DSM-5, when we look at the description of substance use disorder, one of those categories is the drug-seeking behavior. It says I spend more time looking and seeking for my drug of choice and so forth, creating that thing. So that's just another barrier to, that designation of substance use disorder.
Yeah, it gives you time to work on relationships, work on, work, jobs, just getting your life back into a normal routine. It takes out hours of time to, remember to take your medication, go to the pharmacy, get your medication, and you know what? Honestly, most people will miss a dose here and there, right?
Yeah. We all do, right? We all miss that daily thing. There's anything that we would have. I missed my vitamins yesterday. Right? I didn't recognize till dinner time. I'm like, oh, I forgot my vitamins, right? Life goes on. So those, like I said, those gaps are potentially lethal if all of a sudden you go and relapse, especially when we're talking about something as dangerous as fentanyl, right?
Yeah, that's right. If you miss 2 days of Suboxone, the fentanyl will break through. Fentanyl breaks through methadone and breaks through safe supply as well. So we have the blockade and the withdrawal and craving coverage. So people are very happy with it.
I bet. So what is there direct things that, what's the next step? What are you doing? Are we going to try and get this into hospitals or get this into family doctors? Are we going to start selling this on the street corner? What are we doing, Dr. Lee, to make
small steps, Dean. Very small steps. Yeah.
Small steps. We're thinking big. We got the new ultra fast RAM clinic. What's next?
What's next?
Yeah.
We keep spreading the word. And I think the word is being spread in London amongst people who suffer from addiction. That's our greatest advertising is from people who are users, passing it on to their friends. And I do survey and I do ask people, how'd you find out about us? And the great majority of the time, I think 80% of the time, it's from a friend.
Yeah. Word of mouth. People recognize that they're making lifestyle changes, and that's the best way to do it, right? That's the way the 12-step program works. It's all word of mouth, right? It's all people helping people and sharing that information with one another.
Yeah, really, that's really what we try to do, is just the people helping people, spreading the word, and slowly it will make a dent.
All right. We've got to bring it to a close here right now, but really quick, What's the cost of this? How do people get it? I mean, how do people afford it? Is it like in the States where it costs you $1 million for an injection or a pill, or what does it look like?
That's a great question. It is covered on all private drug plans, but most importantly, it's covered by the Ontario Drug Benefits Plan. So anybody who's on Ontario Works, ODSP is covered. Anybody who's under 25, it's covered by the under 25 OHIP Plus. Anybody over 65 is covered by ODB. The only gap is really the working poor, the working person, the working guy who doesn't have benefits coverage.
Yeah. Okay.
And for that, we help people apply for Trillium.
You try to figure it out. You help them all through the steps and
try to figure it out.
Happen.
Yeah.
That's fantastic. Thank you so much for being on the show. Thank you for all the work that you do and sharing that knowledge. And we're certain that there's going to be people watching this show that are going to get those seeds planted and come knocking on the door of the RAM Clinic looking for what they might need, or family members or whatever that can share that information, that word of mouth, so you say. So thank you very much for being on the show.
Yeah, thank you for having me.
Again, you were wonderful last time you were here too. Thanks again, Dr. Lee. We'll be right back after this break. We are so grateful here at Invisible to have so much knowledge and passion and purpose here on today's episode of Invisible. The things that are shared really need to be a message that is heard by everyone. And if you think about it, when you go to your own refrigerator and you grab that light salad dressing because you know that the fat content or whatever's in it's going to be bad for your cholesterol or maybe hurt your heart, that's harm reduction. Going to a bar or the LCBO and buying alcohol that you know is not going to hurt you or have internal damages or do anything wrong to you has been tested and used in a safe way. That's safe consumption. These are the fundamental principles behind harm reduction. That process also leaves the door open, a big door open. If we judge everyone based on the legality or the morality or mark them as deviants because they're using substances, then we're closing those doors to show people that we don't care and that they don't deserve help. And when we look at it not so recently, we can see where cannabis was illegal. And then now we have everybody in society lining up at the multiple shops everywhere purchasing it. So harm reduction is a real thing. It helps save lives and it's really important. So I encourage you all to learn more about it. And here at Invisible, we're trying to change a culture. And in changing a culture and changing time, we need to remember the best time to plant a tree is 20 years ago or right now. Thanks for watching.